Hey everyone, welcome to the Happy Flosser podcast. My name is Billy Lunt. I am your host, and I'm here to talk to you about all things dental hygiene to support you on your journey through the dental hygiene program. Welcome, so glad to have you. In today's episode, we are going to be talking about the most effective way and some of the important things that you have to consider when you're taking a patient's medical and dental history. This is the patient's record, and it's really important for you to be skilled at doing the data correctly. And there are some things that you need to keep in mind as you're doing that. So the patient's medical and dental history is the document of information that you will manage for every single patient that you see under your care. Part of the documentation and dental medical history, the patient's record, is the assessment. So all of the information that you take during your assessment, what is the definition of assessment? Assessment is really just the process of collecting information, collecting data that you're then going to use to assess your patient and come up with an overall judgment of health status, whether it's their caries risk assessment or their periodontal risk assessment or their overall health assessment. It's really what we have to do in order to come up with a diagnosis. The diagnosis is based on the data that's collected during the assessment. And then after you come up with a diagnosis, there's a treatment plan that is created. And the treatment plan for the patient is developed once the assessment and the diagnosis are both completed. So you can see how it is a step-by-step process to go from obtaining the information, which is your assessment, and then collecting that data to come up with a plan, which is your treatment. So you have to go through assessment, diagnosis, and then your treatment plan. Now, really, the whole function of the patient's record is to document the patient's conditions, their diagnoses, the treatments that they receive, and their responses to the treatment. This helps us with risk management. Risk management is the process of evaluating and identifying and reducing harm to our patient. We want to eliminate any kind of risk that the patient might be involved in. And this is where quality assurance comes in. Quality assurance is the information to determine the overall quality of care that the patient has actually received from coming in. Let me give you some examples of good quality assurance. You want to have up-to-date training. You want to follow all of the rules, have up-to-date licensure and registrations. You want to be current in emergency standards and protocols maintained by the dental team. Something as simple as where are all the exits and what do we do if we have an emergency? You want to have proper documentation, things like when were the last radiographs taken? When was the last time the patient was in? What did they have done? And what were the outcomes? What are some of the things that the patient says when they're in the chair? Is that documented? This is quality assurance. You want to have good quality assurance for every active patient that you see. And you also want to make sure that the patient is being seen at an interval that's appropriate for their treatment needs. So you want to make sure that if they have specific dental needs, maybe they're higher risk, are they being seen more often? This is part of our quality assurance protocol. And then there are routine forms that have to be completed for every single patient for every single appointment. There are some HIPAA forms is a perfect example. In the patient's Bill of Rights, they want to make sure that they are understood and documented inside the chart. So these are things that you want to keep in mind and be aware of. And good quality assurance reduces your risk. So that's part of your risk management plan. One of the most important parts of patient record keeping and good data collection and assessment is confidentiality. Everything that is said or done in the dental office must remain confidential. Dental personnel, they have access to a ton of information about a person and a lot of personal information. So part of being a professional is that confidentiality. Breaches of confidentiality, those fall under our ethical principles, and they can have results that are really significant. Losing your license or your certification, lawsuits against people, not just the dentist, everyone involved. So you want to be sure that you are following your rules and remaining confidentiality. That has a really important and significant piece in dentistry. There's a trust issue, and you want to make sure you can't provide awesome care to your patients unless they're confident that what they're telling you will be kept confidential. And think about it. They might not tell you something significant and important that is on their medical history that could be really important information for you to know if they can't trust you. So, in order to have accurate data when you're collecting data and you're doing your assessment, you have to be sure that you've conveyed a level of trust with your patient. Their personal information is really essential for us to properly treatment plan and appointment plan and all the aspects of running a dental practice. The personal information is used for approval of care for minors and other legal aspects of the dental record. And there's also consultations with different providers, and that relationship between the interprofessional relationship between providers is important for us to maintain the oral health of our patients. So you want to definitely maintain that confidentiality so that you are working under the scope of where you're at. You don't want to cause any problems to yourself or license issues. Now, when we take dental health history forms, we're looking for things like a chief complaint, an immediate problem. Does the patient present in discomfort or pain? What are their previous dental experiences? Do they have anxiety? What are their feelings around dentistry or being in that chair in that moment? What kind of history do they have seeing the hygienist, right? Do they have routine history? Are they sporadic? Do they only come when they have a problem, or are they a preventive centered person? And what are their personal care items? If you're looking at the patient broadly and you're looking at their overall health status, how are they appearing? Remember, you're taking that assessment from the moment you speak to the patient on the phone, you see them in the reception area, and they walk back. You're really assessing them from that moment on, not just when they're in their chair and in your chair, and not just their mouth. You're looking at everything. What does their hair look like? How healthy do they look? Are they overweight? Are they having trouble walking? Do they seem agile? Like, what is their exercise routine? How are they taking care of the rest of themselves? These are the things that impact that dental health history. And so these are things that you want to have a curious mind about as you investigate the patient's record. And then you have the medical history, which the purpose of that establishes a really good baseline for you about that patient's medical status. And you want to include the vital signs in this. Assess that patient's overall physical and emotional health, including some of their risk factors for disease, as I mentioned. Identify if that patient has precautions where you need to maybe get a medical consult. Think about your risk management. It's all about managing and mitigating risk. Is this patient a patient that's really high risk and they are going to not necessarily be safe to treat, or they're high risk to treat? There's somebody who might have a medical emergency if you proceed with care. It's all about prevention of those things. So identify when a patient should be referred for a medical evaluation. And remember, it's all about your documentation for that. Some of the oral conditions that you might see during your assessment really reflect the general health status of the patient. We know this as dental hygienists. So they influence the response to treatment, the disease progression. Think about our diabetic patients, slow and poor wound healing. If they're presenting with advanced periodontal infection, you have to think about how that medical history relates to that dental need and that treatment plan. Dental procedures may also complicate other situations, right? So you want to make sure that you are really aware of that medical history and understand the significance of how it impacts that patient's treatment plan. And then what types of questions on the medical history are you going to focus your attention on? There's some systemic oriented questions where they're direct questions that check whether or not the patient has disease or some kind of systemic issue with a specific organ. And then there's disease-oriented types of questions, direct questions about a specific disease. Oh, you have a stomach disease or a liver kidney disease. Now let's talk about specific diseases like diabetes or cardiovascular disease or COPD. And then you have things like system-oriented questions that you will ask. Things like, are you often tired? Are you often thirsty? Do you have a hard time climbing a set of stairs? Are you ever short of breath? Things like that can provide us with so much information about the health status of the patient that really helps us navigate treatment plans and next steps in care. When there's a medical alert for our patient, that needs to go in the patient's record so that every provider has an awareness when they open that patient's record that there's a medical alert on that patient. This will really help kind of check all the boxes of care for that specific patient and the needs that they have. Now, when your patient comes in for an update of their medical history, you have to remember it's constantly changing. They could have been in 2 weeks ago, and now you have a change. So you want to make sure it's every single time you see them, you update that medical history because it constantly changes. That history represents the period during which the history was taken. So if your patient was in 3 months ago, that history is only good for 3 months ago. It's no longer relevant, so you have to update it every visit. So I can't overstate that, right? And I can't overstate documentation purposes as well. It's vitally important that the patient signs that medical history and that they verify that it's accurate. They have to sign the updates as well, guys. And even if there's no changes in their health, you want that documentation that they've verified that there's no changes and there's nothing significant going on. And you have to be really careful when you're doing your documentation that if you make an error, that you don't write over it. Or if you're using a paper chart, just neatly cross that out with a single line, no scribbles. It's a legal document, so it's really important that you follow those guidelines. These are all just generalized suggestions to make you really good at obtaining an accurate medical history. And I will say, when it comes to blood pressure screenings for us as dental hygienists, to me, the blood pressure is one of the most important things you can do. And I will tell you, patient perception is really important here. Sometimes we just don't have a lot of time and we might decide to use one of those wrist blood pressure cuffs. I got to tell you, there's nothing like the old school method. And it comes down to patient perception. I'm just going to be totally honest. If you get an elevated blood pressure by taking a blood pressure with one of those wrist cuff devices, the patient is not going to think it's accurate. If you get out your blood pressure cuff and your stethoscope and you just do that blood pressure and you make that commitment to do it just like your nurse friends and they have an elevated blood pressure, you're confident in writing that as a diagnosis, and so is your patient. Your patient will believe you that you've said they have an elevated blood pressure. Now, if it's elevated, I always wait a couple of minutes and I take it again just to be sure, or maybe I'll use the other arm and take it again. But if it's elevated and there's a significant reading there, you want to take that time to educate your patient on the value of seeing their physician and maybe getting that blood pressure under control and stabilizing it. For some reason, we don't recognize the value of the time of doing that. And I can't tell you how many patients have come back in after I've taken their blood pressure and been on a medication and now it's well controlled. And so don't undervalue yourself in that area. I know it's easy to just grab that little wrist one and go for it, but I'm telling you, the patient understands the perception and the value of having the old school, we can call it old school, the old school blood pressure cuff really seals the deal for your patient to really have a heightened awareness and really take your advice if you say that they have an elevated blood pressure in that moment at that appointment. So, just do it, I guess, is the best advice I'll give you. I just want to thank you all for listening. Please continue to send me messages on episodes and content that you need covered for dental hygiene school, dental assisting school, whatever your path or your journey. I'm always here to help you guys. I also have study sheets and guides to help you along your way if you like flashcards and all those good things. And I also have some inspiring poems. Visit my Etsy site and you can click that link listed in the show notes. And also, I would love a kind review. I always appreciate feedback, and I really hope you guys are having a fantastic week. I'll see you soon.